Professor John Nicholls also joining us now, a clinical professor in pathology at the University of Hong Kong, to address the coronavirus contagion and to share with us, a report from on ground, really. Thanks for joining us, Professor. Let's just, first and foremost talk about how one can distinguish a regular flu brought upon by, say, factors like the weather from symptoms that come about due to the coronavirus.
Is that it is actually very difficult to separate out between the two, because the two can present with very similar respiratory symptoms. However, some of the features about this new coronavirus is that they may actually present with diarrhea, but the thing is that there is no convincing test, clinical thing, which can separate out two, which is why the laboratory test is crucially important. Now, for influenza, there are what we call rapid tests, which allow a diagnosis to be made of influenza within a couple of minutes or 10 minutes. But for the new coronavirus, there is no rapid test. So this means is that you have a problem where you have patients where you can actually miss the diagnosis because there is no good clinical test on it.
Would you advise travel to Thailand, Singapore, Vietnam, or any other Southeast Asian country in the next month or so? We're assuming China travel obviously would be a big no.
The issue of travel is one for the WHO to make, but the thing is that from because of the restriction of travel, it's actually most of the airlines which have stopped the travel have been for operational reasons. The reason being is that they can't get the staff for the turnaround. So, but the actual risk from the air travel is not as great as the things like on container ship, on passenger ships. So one has to balance out the restriction on travel and the impact on the economy versus the potential for the spread. That is it's a big policy decision, which is outside my expertise on that.
What makes the virus so dangerous despite our modern day medical technologies? I mean, we've not been able to get a breakthrough.
Okay, so the reason is that this is what we call the coronaviruses, and the problem is that for the coronaviruses, from the scientific point of view, apart from SARS and MERS, have actually been very, very poorly funded in the past for humans. Now, coronaviruses do cause quite a bit of disease in animals, but in terms of understanding the pathology in humans, it has been really underfunded for many years, because until the advent of the SARS in 2003, the coronaviruses were just thought to cause the common cold, and no one was really willing to fund very much research into the common cold. So the problem is that from the basic biology point of view of coronaviruses in humans, we're actually very much behind the 8 ball compared to other influenza viruses, which have been much better funded and studied. Having said that, we have a good understanding of how these viruses like the SARS coronavirus and the MERS coronavirus replicate in humans. But in terms of the milder coronaviruses, there's been not much funding which has been given in that area.
How far are we from finding either a vaccine or a cure? We've been hearing, the likes of 18 months or so, but what's the latest on that front?
Vaccines, I think, as I've said before, the people's concept of vaccine is based on Hollywood, where they think here's a vaccine and 3 days later there's a vaccine to do it all the world. The inherent problems in a vaccine is, number one, is that you have to actually be able to say that it is actually safe, and that after it being safe, does it actually work? And for that, you need a good animal model to test it on, and right now we don't have that. Then once you do have a vaccine, to say, will it actually work? And then will there be any side effects? Because I think one of the last things you want to do is to bring in a vaccine at such a short period of time in which the side effects are actually no better than the cure. Then the fourth problem is that if you do have a vaccine, which population should you spend it on, because you'll not be able to have a vaccine which can do the whole of the world population. And then one of the things which we'll be looking at very, very closely is that right now is that the Chinese are using the serum of patients who have recovered from this new coronavirus to see will it have any benefit. So the question is whether or not, if people do have what we call the antibodies, that will it have any protective effect? Because there's a chance that even though you may have antibodies, it doesn't actually protect against the coronavirus.
Okay, there have been cases, Professor, of patients first being tested negative and subsequently positive, and vice versa. Do we still not have a foolproof test kit for the virus?
Definitely not. Because of all tests have got number one, what we call false positive and false negative. So there's always an inherent problem with the test. The second problem is that at this stage we don't know where the virus replicates in the respiratory tract, so they may be sampling the wrong area.
Is there any truth in reports that say virus will weaken in warmer temperatures and thus we may see it wane as summer approaches?
That is based on previous published reports, which actually show that most of the coronaviruses have a seasonal effect, and that they peak in winter and they decrease in summer. There's a review article which has come out today, which actually says that most of the coronaviruses do actually grow less at warmer temperatures and colder temperatures.
What are the other viruses out there that could actually have potential of breaking out the way SARS and coronavirus have?
Unfortunately, the reality is that what we saw with SARS and MERS is that there's many viruses which are in the bat population, which don't seem to cause any problems in bats. And so the bats can then have an intermediate host, such as the civet or the camel. And so I think that we will see these other viruses emerging in the future.
All right. Thank you, Professor, for joining us on the latest there.